Good afternoon, ladies. Our webinar is beginning. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council, and we want to thank all of you for participating in this educational webinar today. This is being hosted in coordination with an associate member of the Council, VitaCorpo. Today's topic is workforce readiness, safely bringing employees back to work. The executives at VitaCorpo have a new product, and it is very timely as we come back from COVID-19 pandemic. This is a tool to help employers bring their employees safely back into the office, minimizing risk and also helping minimize any liability for their business. It is designed to simplify the task of monitoring workforces, something that really will become the new normal. We have three excellent speakers today: Greg Harris, Judy Holmes, and Herman Hill. Now, Greg serves as the CEO, Jody is the Chief Product Officer, and Herman is the Chief Marketing Officer. We all look to this exciting presentation. And so it's my pleasure to introduce to you the CEO, Mr. Greg Harris.
Good afternoon. Thank you, Steve and Chris, for allowing us to participate in this webinar today. We're very happy to participate, and we're looking forward to partnering with each of you in the fight against COVID-19 and keeping our community safe. As Steve has mentioned, I'm the CEO of VitaCorpo, and today we want to talk about our platform. We want to talk through some of the features of VitaCorpo. We have a modular solution that allows us to implement the solution according to the vertical markets that we represent, that being maybe education, athletic, hospital medicine, nursing facilities, and so on. We want to talk to you about what makes us different. We want to talk through the services that we provide, being able to manage the population, the type of scanning opportunities that we present from an automated remote checking and monitoring perspective, all the way to manual entry. We want to go through our quarantine methodology, how we are able to manage the testing, and just the return to work protocol. And as any good product or application, data is always going to be the key. And so we want to talk a little bit about our dashboard and reports for real-time and historical analytics. So without further ado, I do want to introduce my colleague. Once again, we have Jody Holmes. He's our Chief Product Officer, and Mr. Herman Hill, who is responsible for setting this all up. He's our Chief Marketing Officer. So thank you so much once again for your time. We look forward to the questions afterwards, and I'm going to turn this over to Jody to begin our presentation. Jody?
Thanks, Greg. We're super excited to talk to you about this today. We've put a lot of time and effort into hearing from how people are operating and the problems that people are having in all kinds of different verticals. And I think we have a really great solution for you all to meet your needs, whatever they may be. Greg kind of went through that a little bit there. So as we went through our research process, we're looking at what is really out there in the market, and a lot of these things really fall short of protecting your workplace and your business for a couple different reasons. Things like manual temperature, the biggest thing there is with false negatives. There's a big problem with people showing up to facilities and doing the temperature on the spot, that if they're just hot, they're going to show a temperature, and you're in this position where you know, are they really showing symptoms, or is this just heat? And so your process can get broken pretty easily with doing manual temperatures. A lot of these other things shown on here also have issues with data and data protection and privacy. As you all probably are very aware, this is actually HIPAA protected data. So writing it in on a notebook, in a piece of notebook paper, or even an Excel sheet, which is what a lot of people are doing, really is not an acceptable practice. And I'm sure you guys are also familiar with the $40,000 a record fine that can come along with improperly handling HIPAA-related data. So what we've done at VitaCorpo is, first is we manage the HIPAA relationship directly between employees and VitaCorpo directly. In the health sector, you guys are more used to dealing with HIPAA, but for businesses and schools, they have no idea where to start. And so this is a big deal for businesses outside of healthcare. The second piece is we created a methodology for people to be able to remotely capture and verify their temperature, blood oxygenation level, as well as complete a wellness survey. Third thing we do is that we compare that data from their capture with standards set by each individual company and business for what is their acceptability for having people come to work, and give them an instant answer whether they meet that standard or not before they leave their homes. And the last piece is we make sure that only workplace ready people are admitted into your facilities and help you manage a log of all of these events. So the way that the platform works is we have a bunch of different options as far as how to actually capture the data. We have a thermometer and pulse ox that work over Bluetooth. We have a wearable device that captures the same data. We also have a thermal scanner that can sit at the entryway. And unlike other ones that are out in the market, our scanner is integrated into our platform. So not only do we get like an instant temperature for people just walking into the building, but we also have a methodology to simply link it to that user's account so that it can be a part of their health story, as you'll see going forward. And now we'll just break out of this real quick and we'll just give you a live demo of how the capture works. So what you're looking at here is my phone mirrored on my desktop. So this is what users see when they log into the app. They show that they're not validated. They have no work or public pass for the day. And so to create a health capture, they just tap the capture button and there I am. They quickly connect to the thermometer. Once it's connected, they're going to basically take a selfie. So they're going to press this button here and it's going to capture three things. It's going to take an image, it's going to capture the temperature reading from the device over Bluetooth, and it's going to timestamp it. And so this gives you a verified reading of whose health data is being sent up for comparison. The next piece is the pulse ox. So it works in much the same fashion. There we go. And captured in the same method. And so we have the verification in between each piece of this so that if you see for some reason you get a bad reading, or maybe you just got out of a hot shower and you're showing a high temperature, that you can retake it and get rid of those false negatives. So once your health reading has been accepted, you're going to be presented with a survey. So this survey is managed separately by each individual company, and it would be, the questions that their medical and legal professionals think are best to maintain and have people answer before admitting them into their facilities. So once they've completed the health capture and the survey, they tap the send to workplace button. So right now what is happening is their health capture is going up and being compared with the workplace standard for temperature, blood oxygenation, and also we have an AI that instantly grades the surveys pass fail. And so in this case, I was workplace ready, so I'm ready to go. In the case that someone did not pass, the system has a notification system that would notify that employee's supervisor that they didn't meet standards for the day, and let the HR function take over from there. And so once the capture is complete, sent back here, and they have a work pass. And you'll see how this work pass is used for entry and several other things as we're moving forward. So after the capture is done, one thing that I didn't mention is that it's super important and super helpful for your operations efficiency to have people do this before they actually get to the facility. In one particular case, a hospital system we were working with out of LA was saying that when they were doing temperature checks at the door with security guards, about 200 people were taking about 45 minutes to get into the building. And they ended up having to scrap the program because they couldn't keep up with patients on a 45-minute delay with everyone getting into the building. So the efficiency of getting people in your facility at the same time as doing a good detailed screening is difficult. And so we've came up with several different methods to help fit into the way your business and operations work. The first is just a simple secure web interface that you can search all the verified people for the day and mark them manually as entered into your facilities. The second piece is a self-scan functionality, and we have a kiosk that does the self-scan with the work pass we were talking about, as well as an administrator can use their mobile device to scan in employees or their laptop to scan them in as well. We also have, like we talked about, the integrated thermal camera entry station, and so this you can kind of double up on the screening, so they can do the screening from home to say, I'm good before I left home, but once they get there, you can do a quick temperature scan as well. And once they've done the scan, that they would go ahead and scan their work pass, and this would connect that reading that they just took from the integrated thermal camera and connect it with their VitaCorpo user data. And the last way is we have a geofence methodology that does automated check-in as people arrive at the facility. And all of this is really important for keeping a log of the people that have entered your facility. So in the case that there was some type of litigation that would come up, you'd be able to produce a log that shows everyone that's entered your facility and that they've been verified against your health standards every single day. As far as a monitoring and protection solution for your company and facilities, it wouldn't really be complete without some methodology for handling visitors and people that actually don't work for your business. So we have the public pass. VitaCorpo is totally free to download and use. Anyone can use it just to take their daily readings and track what their symptoms are and on a daily basis. And along with that, they get access to the public pass. And so the public pass uses CDC guidelines and questions as the verification method. And so guests can be directed to use this before they head to your facilities, or once they arrive, quickly download it. And you could use your own thermometers at the entry or the regular entry methods that you have to quickly and at no cost allow guests to verify their health status, as well as add them into your entry logs to get a complete list of who's been entering your facility. And we've been talking about this health log, and we call it the health story. And so one thing that we really want to provide for our companies is a complete health story of each individual and each facility. And so that includes the total health status. So we've talked about so far a capture event, which is actually capturing the health data, a verification event that's saying, did they meet your workplace's standards for that day? We also have the ability to add test results. So for COVID tests, if someone went out for a test, that could be logged as well as quarantine management. So if someone needed to go on quarantine, you can log it in the system for each day that they were out on quarantine and have this total reporting picture, not only for your management, but again, like we spoke about before, for any case of litigation that may come up. The platform is built in a flexible manner, knowing that we are not going to be able to figure out everything that needs to be captured day one. So we built it in a manner that we can add these events as they become necessary or or if there is something that your particular company would need to capture as well, they can be simply added. And like our next thing up would be vaccine tracking as a part of that. Greg, do you want to talk a little bit about how we've kind of spoke with some other healthcare providers about how they might use the system?
Well, so one of the first things that we spoke to was that this is a modularized system, and it really works within the process of the vertical. And so some of the healthcare professionals that we are working with, for example, they've chosen to, one company or a set of clinics have chosen to take their employees, utilize the system, and use a work pass as it relates to their patients. The other large healthcare industry has decided to take the patients and use it as a means of being able to track patients. And so one of the things that we have done is that we've also, from a contact tracing perspective, incorporated the ability to use GPS. And I know that, to some people might be invasive, but if you're sending a patient home and you want to do remote monitoring, but you also want to quarantine that patient, or you also want to see, so if the patient did not quarantine, where did that patient go? This would be something that would be available. We wouldn't be able to put hardware all over the place just to have a geofence over the world. So we have different usability studies that different verticals are using it and the way that they're using it. And so we want to make sure that everyone understands that according to the process that you are already implementing or want to implement, VitaCorpo will work within that process.
Great. Yeah. Thanks, Greg, for that. And it's another time to kind of note that the platform itself lives under the VitaCorpo banner, but it is built in such a way that it can be white labeled. So if your facility wanted it to be branded with your facility's branding and logo and name, that's an option as well. And we also have an API so that you can integrate the functionality of the app into an existing app as well. So those are two different methodologies to use the VitaCorpo backend and technology, but put it underneath your brand as well. So we have a couple other little features and things that we'd like to talk about. So we also have an option called the verified workforce display, and the genesis was from restaurants and really anything that has a public facing component to it. And what it is a real-time list of your staff that's on site and been verified for the day. So if you think about it in a hospital healthcare situation, maybe it lives in the cafeteria as people are walking in, and you can see the cashiers and the cooks all in this list and just see the green check that they've been verified for the day. Just giving customers peace of mind to know that you're protecting your environment. We've had a huge reaction from the restaurant industry about this, that people really are feeling like people are not showing up because they don't understand what each individual restaurant may be doing to protect them. And so this is just a great way to let them know without having to say a word. So as a part of everything is data and actionable data. So the VitaCorpo management interface has some really simple but powerful reporting tools that can help you identify clusters and hotspots. And the default view is just going to show you within your direct purview as a supervisor how many people had passed readiness for the day and failed. So in the lens of today and this week and this month. So as you start to see, those fails creep up in your purview or say your department, you can start to take action to say, okay, we need to, maybe we need to send everyone in this department off for testing because we're starting to have an uptick in failed readiness, and we want to find out, is this flu or is this COVID, and know to do that. So just having an overall time-based picture of your status of all employees is very important. I guess it's also important to note that when individual people fail their readiness for the day, their supervisors are notified actively. So they'd get an email that says, one of your direct reports has failed readiness for the day, so that you can take action immediately. And especially for, producers, employees that are producers, if you're depending on them to be there to cover a shift, finding out at 7 a.m., 2 hours before they're supposed to report at 9 a.m. that they're not going to make it, gives you a lot more time to react. So there is a huge cost of doing nothing, and there is a big savings that can be captured when it comes to being diligent about testing and using those the testing and the symptom tracking to trigger testing and getting people either quarantined correctly or back to work when they're actually able to get back to work. And the percentages, as you guys probably know, of people that are getting tested, which is what most companies are using as a qualification to send someone on quarantine, is really low. Like in the high 90s percent of people that get tested are actually negative. But today, as we did a study for Sedgwick County, which is Wichita, Kansas, they put together somewhere in the range of $1 million in false quarantine leave in the first half of the year. So it's really important to have a strategy to minimize that cost. And then just simply the efficiency. Having people take an extra time to get in and out of the building, if you're adding 30 minutes to their day every day to do these type of things, a person with a salary of $70,000 a year, each one of those it's gonna cost you $600 per employee to just get them in and out of the building. If you take an extra 30 minutes, having them wait in lines and things like that. And so that is VitaCorpo platform. We're excited to get to share it with you, and look forward to your questions about anything that we may have missed. Like I said, we've built it in a manner that it's meant to be flexible to meet the needs of all different types of businesses and different operations. And we hope you saw that, and look forward to your questions. Thanks for your time.
Yeah, and if you've got questions, folks, don't forget to type them in the chat box, and we'll be looking at them. It shows the questions. And just wanted to remind you to do that. But also, we've got a couple of questions already, and I'm going to go ahead if I could. And Greg, I'm just going to pose the question, and I'll let you pick who up on your team is answer it. VitaCorpo, as you've already mentioned, seems to be an extremely flexible product. But the question is, can you really customize it to conform to the various and different rules that may be unique to a business or to a hospital system?
So absolutely. So the flexibility lies within working within the processes of the vertical that we're working with. So whether you want to use it as a public-facing of employees who have been tested and have visitors coming to your establishment, or whether you want to use it from a hospital perspective of monitoring patients remotely that might have come into the hospital with symptoms that have tested positive, but not want to house those patients within the hospital. So yeah, we have the multiple facets from a technical perspective. The platform is very versatile. We understood that, when you're dealing with all the different verticals that we have been able to deal with, that everyone would be different. And so we have a very large insurance company who is looking to just white label the entire product and make it a part of their offerings, not only just to the various companies within their company, but to the different facets like clinics and things of that nature. So it's very, very flexible. One of the things we like to do is understand the requirements and then work through as a partner, not as a vendor, but actually partner with our partners to make sure that the implementation is done correctly.
You know, here's a comment and a question. One, they said they really like your platform. And then their question is, how close to real time is the data available for analysis?
So you have two forms of data analysis. You have the reporting, which is historical data, and then you have the actual dashboard technology. So the dashboard is going to provide you real-time data reporting as it's happening. So if someone fails a test or the vitals are not meeting the corporate standards, then it's going to show you that once they submit. And if we are running across a spectrum of a week or a month, and we want to do studies to understand, what's happening in the company, then we can do those analytics from the reporting factor, right? A lot of the data that they see is, as Jody is showing on the screen here. So as they go through their testing, it becomes available immediately.
Okay. Another question that has been submitted, can VitaCorpo integrate with hospital data, patient data, etc.?
Absolutely. So we utilize the same industry standards when it comes to hospital data and dealing with EMRs and EMSs, which is we integrate with the HL7 feed that comes from the hospital. So we're not necessarily integrating directly into putting data back into the EMR, but we are allowing patient data or patient record to create that patient as a user within the platform.
Another question, and let's say you put your product in a hospital, how does contact tracing work within your product, not only related to patients, but also for staff?
So understanding the setup of the hospital would be very important, but when we talk about our geofencing, we have a hardware device that allows us to pinpoint your movement down to a room. Of course, that's something that would have to be purchased, but for example, for the University of Texas, so when a student is going into facility A and they're going into room, Z100, we can pinpoint it down to the exact room that they entered, right, in the facility that they entered. Outside of that, you would have to really geofence the entire campus, which the DPS model would probably be a little bit more fluent of an option for that.
I know during your presentation you went and showed if an employee failed the test, that human resources would be notified, and then the policies and procedures would kick in. But this question that we received says, does your platform provide alerts to the employee and to the appropriate person like HR or patient for failed tests? I guess what they're really asking is, can you make sure that everyone that needs to be notified is notified?
Jody?
Yeah, so yes is the answer to that. So each employee has a supervisor listed in the system, and that supervisor is notified in real time when they fail a test. There is also a departmental admin feature that can happen. So your direct report supervisor and your departmental admin can be notified on failed tests.
Okay. And I know you covered this in your presentation, and you went through a lot of the checks and balances and security, But the question that came in, as far as this information, is it totally secure within your platform?
Yeah, so our platform has been reviewed, and we've gone through a HIPAA compliance review. And so we meet all the security standards for HIPAA. And it actually is, it's a AWS hosted, and they have a HIPAA compliant program and kind of go through what the security for health related data needs to be. And so we're also compliant to that as well. And just being a part of AWS, you also get their overall network security of AWS. So rather than having to manage your own security patches for networks and all these things that can come up, you have Amazon kind of backing that for you. So I would say it's very secure, and it's actively monitored.
And I would
And so let me,
this is Herman. I would add that, remember that when your staff or employee takes their vitals, that information is then translated into whether they pass or fail. So that data that is transported over to the supervisor would only be a green check mark or a red X. So the history that's in that employee's phone is now private information that they're only able to see.
Correct. And yeah, it's all explained a little bit farther. So for each individual user, they can see what I was showing here a second ago, right? Each individual user within their account can see their individual actual health captured data. From an employer standpoint, you see the verification. So you see that it met your standards that you set in the system, but you don't actually see what their temperature was or the answers to the survey. You've just seen that they've met your standards for all the above tests. And another piece that I failed to mention as far as security is that all the data that is a part of the system is encrypted as it's transmitted, and it's also encrypted at rest. So if someone was to gain access to our database, what they would get is just a jumbled mess of computer data in computer unreadable computer code, rather than temperature equals 98.6.
Right, and I just wanted to cap that also, Steve, that we've undergone internal penetration testing, but we are available for public penetration, outside penetration testing, as well as the going through the high trust and SOC 2, currently permissible in the Amazon environment. We've been tested for the EC2 instances. Things like the gateways, the balancers, the code front, and things of that nature. So very, very much secure, but we'll go farther for customer requirement.
Great answer and great advice, especially on the penetration testing. Here's another question that we received. Basically they said when you introduced, Steve, you mentioned the new normal, and we really don't know in the new normal what kind of litigation or potential litigation will come out. Does the platform help, or do they have recommended documentation that the employer keep in the event there is some type of litigation or lawsuit filed against the employer?
Jody?
Yeah, so what we would do is we can kind of guide you through what we have put together as far as a package to present in that case. And so really what you would do is you could run a report for your facilities, and it would show everyone that has entered the facility and their verification for that day, so that you would be able to show that you only allowed access to people that had met your workplace standard, And so really what's happening is they're suing you for negligence, right? They're suing you to say that you were negligent in protecting them from whatever would have happened at the workplace. And no one can be expected to 100% stop the transmission of COVID or honestly anything. You just have to be able to prove that you are doing what is possible to be done. And with VitaCorpo, you'd be able to show a dedicated report of exactly the status of every person in your facility. It'd be pretty hard to say that you've been negligent if you can show a definitive list like that.
And
yeah, I think
as I might add, we built the platform so that every employee would be playing on the same field. So there's not a level of inconsistency, because whether you met your standards or not, the system will tell you. And if you don't meet your standards, then you definitely won't be allowed into the facility. And Jody mentioned the geofencing component of what we're actually doing. The geofencing system is built to notify if someone who is let's just say a visitor or vendor is walking into your facility and not using the VitaCorpo platform, that administrator supervisor is immediately notified that someone is in your facility. So we built a platform to, of course, mitigate risk for the employer.
I think y'all's answer is great, and it's been a while since I worked in a hospital, but another thing I was thinking of as I was reading that question, you really provide the platform and the tools so that this can be conducted to help manage risk. As far as how the facility would then use that documentation and catalog it, for lack of a better term, related to any potential litigation, should be done with their own internal legal staff, where you provide the tool, but you're not really giving legal advice as to how they should do it.
Absolutely correct.
That's correct.
That's correct. Our platform provides them the ability to easily access and export the data related to the protection of their facilities and the health status of every employee every day.
We got another question, and they kind of made an assumption, but they also asked a question. They like the system, it looks good, but it seems to be geared for larger organizations. Office is less than 15 people. Could this be used for an office that small, or is there something else that we should do internally?
No, so that's the flexibility part of VitaCorpo, is that it doesn't matter how large or how small you are. You can use it for 3 people. I know that for myself, I have a wife as a teacher and kids in school, so we're using it as a family just to make sure that we're checking our vitals, being that they're in college and in med school. And so we have clients right now that are already implemented that are, 15, 20. We have a pediatric clinic coming on that's 26. So it really doesn't matter. And it's an affordable solution, because when you look at a price model that goes with that, you're thinking anywhere from say $90 to $115 a year per person. So it's very affordable.
And
that was a good question.
And that price would include the IR thermometer and oximeter.
The price does include that?
It does.
And that's a good point. It also includes support.
Okay. That was a good question. It's good to know that, an office 2 or 3 people, you could still accommodate that. That's a great answer. I think, Chris, unless you see any more, that's probably all the questions at this point. Do you have any other questions?
I don't. I think that's all the questions.
That's the questions. Well,
we did record it.
Yeah, this just so folks that are on, and we've still got quite a few attendees on. this is being recorded and Chris will send it out. But I'm going to turn it back over to Greg Harris. But before I do that, thank y'all so much. This has been a very interesting webinar. It's a great platform, and I think you're 100% right. As we go into the new normal, we're going to need these kinds of tools and platform to document what we do. So, Greg, thanks for a great presentation, and I'll let you have the last word.
Thank you, Steve. First of all, I want to thank you guys for allowing us to participate. We're thrilled and excited about the opportunity to add some value to this fight against the pandemic. We're also excited that we get a chance to partner with industry experts like yourselves to continue to evolve as this pandemic and the new norm evolve. So we want to reach out to you, and you reach out to us to provide input, ideas, because this is not just about a product, it is about our safety moving forward. Steve and Chris, just thank you for this opportunity. And I'd like to thank my team. Thank you, Herman, for setting it up, and Jody for doing an excellent job with the demo. And if you have further questions, even after we are off this webinar, please feel free to visit the website and contact us, visit our LinkedIn page, our Facebook page. And, one of the questions that we get, so how new is it? Is as new as COVID. And so that's how new we are. But we are excited because I think the opportunity to help make people safe, feel comfortable and safe in their environments, and get back to in-person learning, in-person working and things of that nature is an exciting step for us. So thank you once again, and I hope you guys have a good rest of your day.
Thank you very much.
Thank you, everyone.
Thank you all.